Okay, I'm just taking a look in your ear here, and you said when you came in that you woke up in the forest, huh? And when you woke up, you were in a circle of mushrooms. Well, that, my friend, is called a fairy circle. And that means that you probably got whisked away to the fairy realm for the night, which usually not that big of a deal, but we are going to give you a checkup today with me, the wizard doc, and not my twin brother, Dr. Tingle. While a very, very good doctor, he has no clue what he's doing when it comes to magical maladies like me. So we're going to do a very simple general exam on you, a little cranial nerve testing, just to make sure that those little fey folk didn't knock anything loose, and I'll check you out for any other kind of injury or signs of magical creature interference. So why don't you just relax? Why don't you just look at me? I'm just going to feel that face of yours. Aside from being kind of groggy, you feeling any other kind of issues going on? Okay. Yeah, it's a bit windy out tonight. Let me just take a look over here. Oh, turn your neck for me. Yeah, turn your neck. Does that hurt when I touch your neck there? You may have got a little bit of a nick from a vampire, but let me check the other side here. Yeah. See, and I say a nick because the puncture wounds are so slight. But we can take care of that with what I like to call a little quick heal spell. So I'll just give that a little bit of the Helio-delio. Boom. Done. Easy. Doesn't look like the vampire actually tried to feed on you, just took a little taste, so not a big deal. It happens to the best of us. Oh, I've been treating magical injuries for many years. I've seen it all. But let me keep taking a look at you, okay? How are those eyes? A little blurry, probably. Yeah. After a night with the Fae, I can see that. You know what? I'm gonna take a look at those eyes, if you don't mind. Alright. Just give me 1 sec. Alright. I want to take a look in those eyes. And even though I am a wizard, sometimes medical tools, like my ophthalmoscope here, look straight at me, please, are very helpful. Good. Okay, look straight at me. Good. Okay, now I'm going to get real close and look inside your eye. Just looking for any signs of basilisk, paralytic, or possible Medusa ricochet if you got a reflection in a mirror or something. But go ahead, look up for me. Good. And down. To the left. To the right. Good. Take a look at that other eye real quick. Okay. Take a look up. Good. And down. Alright. To the left. And to the right. Okay. Not seeing anything in the eye, which is good. We still need to do some eye tests, if you don't mind. And I'm going to ask you a few questions while we do this, so I want you to just look at my fingers. Okay, good. How many fingers am I holding up? 2, good. Alright, now look at this finger. Good. Follow my finger. Just follow. Good. Keep following. Do you remember eating anything last night? Drinking anything, if you can remember your time with those Fae folk? Okay. Alright, so tell me which finger's moving. Good. Good. Both good. 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 Very good. Both good. Good. Very good. Good. Both good. Alright, so I want you to keep looking straight at me. I'm going to test your peripheral vision. So I'm waiting to tell me when my fingers come into view and when they go away. Alright, so when they come in, good. When they go out, good. When they come in, good. And when they go out, good. 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 Very, very good. So let's keep going with those eye exams. I want you to tell me how many fingers am I holding up. Ready? And 1, good. 3, good. 5, good. 4, good. 1, 7, 10, good. 9, 8, 1, 2, 4, 8. Very, very good. Okay. Well, your eyes are looking good so far, but I do want to do a few more tests, including light sensitivity. So we're going to use our little candle here. Just going to get that lit real quick. And I'm going to just cover one of your eyes, and I'm going to swing the light in and out, and then in and out, and then in, out, looking for that pupil response. Good. Very good. Good. Let's try the other eye now. Good. 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 Now, I want you to use both eyes, and I want you to follow the light, okay? Just follow. This isn't a test. It's just to make sure that those eyes are still working and that there's nothing wrong. Just keep following. Good. To think that maybe you saw some things last night that you might not have liked, because your eyes seem a little cloudy. So it looks like the Fae may have put an obscuring spell on you. It could be just to help hide you from the supernatural world, but maybe they just don't want you to find them anymore. But either way, I'm going to be making you a very, very helpful health potion today that will absolutely have you feeling so much better, and it will take care of all of those maladies. because I have unicorn powder. And that cures everything. But we're going to continue the exam on you. So I'm going to take a look in your ears, if you don't mind, to make sure that you don't have any tag-alongs. You'd be surprised how many patients I get that come in with what they think is water in their ear, and it turns out that it's a water nymph. So you can just close those eyes if you'd like, and I'm just gonna take a look inside your ear again over here. As I was at the beginning, and yeah, I'm not seeing. Wait, who's that hiding back there? Oh yeah, looks like you got a little water nymph back there. That's okay. We can flush out that little bugger. Let's check out the other ear here, okay? Same thing. Look at that, look at that. And that is an annoying little water nymph. In both your ears. So we're gonna have to take care of that. This is a very, very special medical wand that will help me clear out these ears. So you just close your eyes. You might hear a lot of very gentle scrubbing, picking, and fizzing sounds, but it's all to help you clear out these ears. So just relax, close those eyes while I just start and put the spell on this ear like that. Good. And on this ear over here. 1, 3, 5. So we're gonna let the ear cleaning spell work on you while we continue the exam. And to do that, we're going to grab our magic ball here, and we're going to see if it shows us anything about you and your malady. Let us see. Can we see anything about you? It's not showing me anything quite yet. Might be the wrong channel, might be the wrong ball. Why don't we try out a little one? Sometimes the little ones can show us the details that we miss. So why don't we just check this one out? Okay, let's see. What does the ball say? Getting nothing out of this one, which is a tad concerning, considering that I'm not seeing any divination on your future, but it's probably just the Fae throwing a little obscuring veil over you so that you don't go talk about what you saw last night. So nothing to worry about, but those ears should be finishing up getting cleaned right now. So I'm just gonna take another look inside. So just close those eyes and let me take a look. Oh yes, much cleaner in here now. Good. Let's take a look over here. Oh, look at that. That's much better. And no sign of those pesky little water nymphs. Wonderful. I have to say that I do amazing work. So we're going to do a little testing on you. Alright, so I'd like to do some hearing tests on you. So the first one, I'm just going to have you close close those eyes for me, and I'm going to whisper a word in each ear. And you just repeat it back, okay? Alright, so close those eyes. Magic. Good. Alakazam. Good. Unicorn. Good. Basilisk. Good. Hydra. Very good. Sleep. Good. Dream. Good. Now, what I'm going to do is have you keep those eyes closed for me. And I'm going to whisper a number in your ear while making a noise in the other. You just tell me what the number is, okay? Alright, so keep those eyes closed for me. And 44, 69, 72. Good. 23, 87, 94. Good. 2, 36, 54. Good. And 71, 42, 33. Very good. So, I say that those ears are intact, and while I know you're still not feeling great, I'd like to see if there's anything else wrong with you. So let's go to the runes and see if they can help us figure out what's going on with you. So just look down the table and let's see if the runes can tell us anything, okay? Okay. Alright, well, I have never been one that was gifted in runology, but maybe tonight the little runic glyphs can give us an idea of what's going on with you. These little tablets of prophecy. So we're just going to give the bag a little mix up, and then we'll see what comes out. We'll see what the glyphs say about you in this mystery ailment that brought you to my shop tonight. So let's see what the glyphs say. Well, now, what do they say to you? Can you recognize any of the runes here? No? Because to me, they're telling me nothing. Let's try again. Let's see if we can get the runes to speak tonight. Now this is a little more promising to me. You definitely left this earthly realm, which is why no regular doctor has been able to help you. No, you definitely were taken somewhere. And my guess is that damn fairy court was having a little fun with you. But there we go. We can absolutely find a solution to your problem. Yes, definitely, definitely those Fey folk. I know we have a few left. Let's see what they tell us. Well, at least we know now that, yes, none of the changes will be permanent, and I will absolutely be able to help you tonight. So let's get back to our exam and maybe mix you up a potion. Well, doesn't look like the runes told us anything. So we are going to move on with the exam with a sensation test. So I'm going to have you close your eyes. I'm going to touch you with either the fluffy brush or the dull tip of my wand, okay? So it's going to be fluffy brush or the dull tip. So just close those eyes and touch, dull, fluffy brush, good, dull, brush, dull, very good, brush, dull, brush, good, dull, good, brush, dull, brush, dull, very good, brush, brush, good, dull, okay. You can go ahead and open those eyes. So physically, outside that little vampire nick and a couple fairy scratches I see, I can't find anything really wrong with you, but I do think that the Fae might have put a little obscuring veil on you, which should fade in approximately 3 to 6 months. I wouldn't worry too much about that, but in the meantime, I'm going to pop on my apron and we are going to mix you up a little potion to help you feel better tonight, okay? Alright, so you can just sit back, relax, and you can just watch your potion get made. Alrighty, let's get to it. Alright, well, now that we've diagnosed you with kind of a little bit of every malady from every magical creature in this forest, why don't we get to making you a little feel better potion that will get you off to sleep. And with all good potion making, safety first, so always wear gloves and safety goggles, but mostly gloves. So since you have quite a few things going on, we're going to have to make you a very potent potion today. And that always starts with artisanal Antarctic glacial water from a very, very deep magical wellspring. And of course we have my little box of rare magical ingredients, and I will show you exactly which ones we're going to use today. So, because you are so ailing, we have the kidney stone of a troll. We have some reef crystal from our mermaid friends. Some traditional frog's eyes. And then we have our fire elemental powder, our fairy dust powder, very potent, and most importantly, unicorn dust. And this is what's going to help you feel so much better tonight. And we also can't forget our very magical roses. And deep in here you can still see some miniature unicorn ears and a horn. All very sustainably gathered, of course. So we are going to begin with just the basics, and then we are going to combine all of our ingredients. So to begin, we are going to take our beaker here, and we're just going to add our water. That should be enough for a dose tonight and a dose tomorrow. So first thing we're going to do is add a little frog's eye. And we're going to keep all of our ingredients whole. Maybe one more. There we go. We keep all of our ingredients whole to ensure the most potent effect. Now let's grab a little reef crystal here. A very calming crystal that will spread the calm of the ocean in the potion. And then, of course, we need to get that troll kidney stone for the antioxidant effect. Why do you think they have such great regenerative healing properties? There we go. And you can see that the potion is already starting to dissolve all of the ingredients. So we're just going to give these a gentle mix. Before we go adding anything else. And really all we're looking for is to extract most of the active ingredients which have released themselves already, which is great. So let's prep our potion bottle real quick. nice clean one here for you today. And we're just going to gently fill that up. And we're not going to leave any of the chunky bits. There we go. So you can see that the potion already has a little bit of magical shimmer to it, but we're going to enhance that a little bit. Now, this is concentrated healing essence, which is why it's green. It's very, very, very potent. This comes as a product of the world tree. The distilled sap of the world tree, which is what gives it its greenish hue. Let's add a little magic, shall we? Hippity bippity, give me that skippity. Oop the doop, cure the scoop. And let me just I think we can do better. We can add some of that unicorn powder to really bring out the healing effects. And this is an extremely, extremely potent material here. I want to make sure we give you enough. So that we get the most out of all of the healing effects of this potion. Just like that. That's looking absolutely perfect. Wouldn't you agree? You can see the magic inside. Absolutely stunning. So let's get you some of this, and then let's get you off to sleep. Well, we did come up with a very, very potent health potion for you tonight. So I'd like you to take a sip of this now. Good. And you're going to drink the rest in the morning. And you're going to stay here tonight at the Wizard Doc office so we can observe you. And that potion's going to make you very, very sleepy. So if you'd like, you can just close those eyes. And we're going to do just a little bit of gentle light magic on you. Just super gentle light magic. And you can let your eyes drift. And you can let your eyes close. And you can just drift and fall asleep. Fall asleep. And just know that the Wizard Doc is taking care of you. You don't have to worry about a thing. So just close Close those eyes. Close those eyes. Close those eyes. And just fall asleep. And just have sweet dreams. And don't worry about a thing. And I will see you in the morning. Good night.